So we'll be talking about some special disease conditions, all right? And we've been trying to actually link these disease conditions that, okay, if they occur in pregnancy, what will happen? What will be the outcome? So one of these disease conditions is Cushing's syndrome. I've spoken about Cushing syndrome for a very long time, all right? So one of the most famous characteristics is the person is having a moon face, all right? Moon face, okay? So on the stomach, the person is having all those striates. But note that normally when women are pregnant, they can have stretch marks. Now there are some stretch marks that comes with Cushing syndrome. That's why I see as the stretch mark from pregnancy join, stretch mark from Cushing syndrome join, everything is now worst. Do you understand? So normally some pregnant women, they become large in size. That's obesity and stuff, right? Cushing syndrome also gives obesity. So everything is now combining from the pregnancy side, from the Cushing syndrome side, and is becoming worse. Okay, so let's talk about it. All right. So to see a pregnant woman with Cushing syndrome is rare. Okay, but if you see it at all, it's a serious hormone issue. Okay, so Cushing syndrome is usually caused by cortisol levels are high. Cortisol is that hormone produced by adrenal glands to help you manage stress. So most of the times, if cortisol levels are high, there's a problem with the adrenal gland, like adrenal tumors, or maybe tumors from the pituitary gland. So it poses significant risks to both the mother and the baby. All right. So why is this challenging? Is I'm telling you guys that, all right, a lot of things that happen in Cushing syndrome are natural things that should happen in pregnancy. So somebody can be pregnant, have Cushing syndrome, and you won't diagnose it quick because you feel like the person gaining weight is because of pregnancy, the person having hypertension is because of pregnancy, the person being weak is because of pregnancy, the person having stretch marks is because of pregnancy. Do you understand? So the Cushing syndrome will now be underneath, eating the person up because you haven't diagnosed and treated it. So hormonal changes in pregnancy, they naturally elevate cortisol. So these are marks. So rare occurrence is just 300 cases reported globally. Okay, so the problems that a mother will have, the problems that baby will have. For mother, hypertension, all right, pre-eclampsia, gestational diabetes, heart failure, infections due to weak immune system, right? Weak bones, that's osteoporosis. Okay, and the bones are now prone to become fractured. Then complications on the baby side. You might give birth to a baby and the baby is premature. Alright, intrauterine growth restriction. Alright, stillbirth, you give birth to a baby and it's dead or something. Adrenal insufficiency. So diagnosis, you're just trying to check out for cortisol levels if it is high. Right, so midnight salivary cortisol, 24-hour urinary free cortisols. Right, also check out for adrenal corticotropic hormone levels. Right, then you can also do imagings of the adrenal gland or the pituitary gland to see if there's any tumor there. The hair cortisol testing is imagined, okay, but still some 1 or 2. Right, research on that. So you can pause here and observe, how a patient with cortisol will look like. All right. So treatment options: surgery. If there's a tumor in the adrenal gland, try to remove it or remove the whole adrenal gland. Alright, if there's a tumor in pituitary gland, you try to remove it. So medical therapies, methatrexate can reduce cortisol levels. Carbagoline, sometimes used for pituitary cases. Ketoconazole, right, generally avoided due to teratogenic risk, though, right, but can also help in that. So that's just what this disease condition. All right, if it occurs in pregnancy, that's how it will be like.